Good afternoon, everyone, and welcome to today's webinar, State-Local Team Approaches to Prenatal-to-Three Services, hosted by the National Collaborative for Infants and Toddlers Capacity Building Hub and the partners to the collaborative. The collaborative promotes and supports intentional programming and services to pregnant women, young children, and their families. My name is Karen Ponder, and I work with the BUILD initiative. My title is Distinguished Fellow. I'm delighted to facilitate today's webinar and conversation that will focus on prenatal-to-three services through statewide policies using state and local partnerships to achieve better results, including dismantling inequities for children and families. Currently, when we're all dealing with COVID-19 in various ways and are very limited in how we interact with others, we recognize that our collective mission to serve young children to the best of our abilities is at even greater risk. The major challenges and stresses that families are experiencing increases the vulnerability of our youngest children. And we're all thinking about and trying to find ways to continue our supports so that children thrive now and as we move through this global crisis. Before we move into the presentation, I want to go over a couple of housekeeping reminders just so you are aware. All of our attendees will be muted throughout the presentation, including during the question and answer time, because of the large number of participants that we're expecting to be on the call today. However, all attendees are encouraged to enter their questions in the chat box that is located on the menu of the Zoom dashboard. Presenters will answer as many questions that are in the chat box as possible during the Q&A section of our time today, and will follow up with answers to the ones that we can't get to after this webinar is over. We also encourage everyone to share your relevant experiences or opportunities, things that you're doing to assist families with young children who may be experiencing the detrimental impact of COVID-19 so that we can continue to learn from each other. After the webinar is over in a day or so, you'll receive an email from the Hub that will include the presentation as well as other related links. I want to acknowledge that our audience today includes various approaches and age ranges, and we will focus specifically today on prenatal-to-three because of the great needs that exist for this part of the birth to third grade early childhood age range. As you listen to our presenters, we want you to think about your work within the context of your own community and state. And just consider how the state and local connections may be strengthened to serve the youngest children and their families even better. So why should we prioritize prenatal-to-three services? I think there are many reasons, but the two major ones that always kind of keep me grounded in this area are: the first one, the earliest years of life lay the foundation for all future emotions and learning. I shall never forget when Dr. Jack Shonkoff told us that the brain research is an argument for the very first year of life, even though it's been used effectively to expand the pre-K movement. Children are not perfectly okay after they're 1 year old, but the brain research that says it's the greatest learning time and that lasts for a lifetime needs to be approached in the first year of life. So all future education is built on the foundation of a child's beginnings. So that's the first reason. The second one is, if you look at the amount of funding that is dedicated to meeting the needs of young children and their families across your states, across the country, you see that often infants and toddlers are at the low end of that continuum of funding. They're often more challenging to serve well, as we all know. It costs more to serve them well because of ratios and other things. And there's less money in our systems dedicated to the population of birth to prenatal to 3 years old. What we found in North Carolina as we expanded pre-K statewide was that the funding and services for babies actually decreased. We had several studies that showed that time and time again. And poverty, as well as cultural and racial inequities, limit access to those resources that are already available and ultimately hold children back from reaching their full potential. So this is why it's important to focus and prioritize the first years of the most critical period of growth and development, and the needs are so great to serve our youngest children. Today, you have the great pleasure of hearing from leaders in 2 states who are working to advance prenatal-to-3 services and their supports. You'll learn how they are partnering and working together to get better results, and you'll hear how the state and the community are working together. So you're going to meet from the state of Texas, and particularly Tarrant County. You'll hear from Andrea Payne, who is the Prenatal-to-5 Advocacy Manager of Tex Protects, which you'll hear more about. You'll hear from Michelle Larva, the project manager of the Early Learning Alliance that's actually in Tarrant County. And you'll hear from Audrey Young, the Child and Adolescent Health Branch Manager in Title V, Children with Special Health Care Needs Manager, as well as the Director of the Maternal and Child Health Unit of the Texas Department of State Health Services. And you'll also hear about work in Michigan, and particularly in Kent County, Michigan. You'll be meeting Matt Gillard, who is President and CEO of Michigan's Children, and he is also the co-chair of Michigan's statewide Prenatal-to-Three policy initiative. You'll be hearing from Anissa Eddy, who's a Pritzker Fellow and works with K Connects and First Steps Kent. And then you'll hear from Alexa Kramer, who's the Director of Government Affairs at the Grand Rapids Chamber of Commerce. We're so honored to have you all with us. And as we listen to you, we want our participants to make notes of any questions you may have for them about their work, and add these to the chat box if you don't hear answers during the presentations themselves. So we'll first turn to Andrea Payne from Texas. Andrea, will you kick us off?
My pleasure. Thank you so much, Karen, for that introduction. I'm Andrea Payne, and I'm the Prenatal-to-5 Advocacy Manager at Tex Protects. And so I'm going to give you guys a little bit of background on what we're doing. So Texas, as you can imagine, is a very, very large state. We have approximately 1.2 million children between the ages of birth and 3. And about half of those kiddos are low income or below 200% of the federal poverty line. Our Texas system is big. It's also complex. We have 6 state agencies and non-agency offices who lead early childhood. So we've got our Education, Health and Human Services Commission, Workforce, Family and Protective Services, State Health Services, and Head Start State Collaboration Office. So coordination across all of those is really important. Texas is also just really, really big. We have 254 counties, over 1,200 municipalities, of which 352 are large enough to have home rule. So our counties have a little bit more limited regulatory authority, and our home rule communities, these municipalities, they do have a lot more control over the things that they can do. And then our state agencies, of course, because our state is so large, they actually divide our state into regions, and these look different depending on the agencies. But oftentimes, in order to do things, they will contract out with community-based organizations in order to deliver some of these programs and services. And I saw a quick question about home rule. Home rule is just that you have a little bit more of your own ability to make rules and regulations for your community. Otherwise, if you're not home rule, you're just only enforcing what the state has for you. And our Texas Prenatal-to-Three collaborative, tying all of this together, is an umbrella group for those prenatal-to-three stakeholders across all of these levels, the city, the county, community-based organizations, and our state agencies, to just learn from what each other is doing, discuss policy priorities. And we've developed a strategic agenda. We're really thrilled to have over 110 organizations who participate in this. We have those 6 state agencies and offices, as I mentioned. And then we also have 7 cities and 3 counties who are involved with us. And for us, it was always really critical to look at legislative and regulatory strategies at the state level, but recognizing that the communities are really the key to actually serving those families and getting work done. And so it was really, really important for our Prenatal-to-Three collaborative to integrate that community perspective from the very beginning into whatever state strategies we had. We were really lucky. We had 2 local Pritzker funded communities, both Austin and Tarrant County. And so we brought them onto our steering committee, as well as our United Ways of Texas, which is able to give the perspective of communities across the state, particularly some of those that are more rural. And so we really wanted to be considerate of that dynamic of the state and local relationship and how they can support one another's work. We really want to make sure for the communities that we are elevating the great work that is being done so that they can learn from one another and replicate each other's work. And if something is really fantastic, then we can always lift it up to a higher level. And so my partners today are going to share one of these examples, which is coming from Tarrant County, which is actually a major part of our statewide PN3 agenda. And with that, I'll hand things off to Michelle.
Thank you, Andrea. Hello, everyone. I'm Michelle Larva. I will be sharing the Tarrant County / Fort Worth local side of this. So just to start off, some context for our area. We are a city-county partnership as a PN3 community. Tarrant County received one of the first set of grants awarded to counties in the NCIT effort. And as National League of Cities rolled out its second cohort, the city of Fort Worth, which is one of the 2 major cities in our county, was invited to join. So that's why we have both governing bodies named it there at the top. So our initiative is a collaborative with more than 20 organizations that are engaged, but we have 4 entities in particular that are leads of this effort. It's My Health, My Resources Tarrant, which is the ECI Part C provider in our county, and as well as for other surrounding rural counties. We have the Early Learning Alliance, of which I'm the project manager. It's a local collaborative of early childhood organizations on a 10-year movement. We are not a formal nonprofit. And then the Tarrant County Public Health, which was the first award recipient, and finally the City of Fort Worth, specifically the library department, since that's where the family engagement efforts are concentrated in. So this timeline illustrates essentially the progression of our initiative. And as you can see, we have been at this for a few years. We like to say we move fast, but building these systems and these relationships does take time, at least here in Texas. I'm sure it is that way across the nation. And so just a few highlights from this timeline that I would mention. This all began with project launch and the HOPES grants when we started to look really at developmental screening in our community. Our early learning collaborative started to focus on infants and toddlers, and specifically with promoting developmental screenings. And through these different grants, these different initiatives that started a little bit isolated, we started to kind of build on those isolated initiatives and pull them together in order to what we now have, which is part of the PN3 effort, you know, eventually going into working with NACO, working with NLC, the National Collaborative for Infants and Toddlers, launching Family Connects, and quite notably, becoming the first Help Me Grow affiliate in the state of Texas. So we are pretty proud of this. We heard of Help Me Grow through the National Collaborative for Infants and Toddlers. And so through that, we've just kind of built on all these different efforts across time to start launching our centralized access point with a system called Find Connect. And overall, we've screened over 11,000 young children, and about 6,000 of those are infants and toddlers. So considering we have not been working with Help Me Grow until this past few months, we're pretty proud of those accomplishments. Now, it's not like one day we started to have a state-local collaborative. Sometimes this looked more formal and sometimes more informal. With launch and with our developmental screening efforts, those were informal. We were essentially aligning local and state goals. But now with the state PN3 work and with our collaborative working more closely with state-level agencies, this partnership has kind of become more formalized. So as we started to pull together Help Me Grow here in North Texas, we needed to make sure the systems we were building would be complementary and parallel with what the state was investing in. And we were already kind of noticing that we may run into some sticky things on that front, as different systems were being built at the same time. So we needed to make sure we were connecting. So in the meantime, the launch grant was also ending, and the state was looking at, how do we not drop what we've been working on? How can it live on? And so Help Me Grow, we thought, was a great solution to offer the state developmental screening work group, which we were a part of. And so meanwhile, the word kind of started to spread about Help Me Grow and how we were building a centralized access point. And several communities across Texas were interested in what we were doing. We were being approached to support them in potentially doing the same things. But we lacked a mechanism in place to formalize and spread. So our fearless leader and chief of ECI, Laura Kender, reached out to the state's Department of State Health Services. And this led to conversations about how the state could support Help Me Grow more broadly. And Audrey will present on that next. But from our end, what this now means is that our community can act as a demonstration site for other communities, as well as for the state of Texas, for implementing this system framework of Help Me Grow, so that we can mobilize other communities to move in the same direction. This is generally the strategy in our state, and you may be familiar with the strategy where communities develop things at the local level and then demonstrate its effectiveness and then inform state decision-making and planning, sort of a bottom to top approach. And so at this point, I will ask Audrey to share what this local state collaboration has looked like from the state level perspective.
Hello, everyone. I am Audrey Young, and I am the Child and Adolescent Health Branch Manager at the Texas Department of State Health Services, which is our state's public health agency. So our unit is responsible for implementing Title V activities throughout Texas. And one of our main priorities for child health is to increase developmental screenings throughout the state. And we were first introduced to the Help Me Grow framework by the MHMR of Tarrant County through the Project Launch expansion grant that Michelle mentioned earlier. And DSHS was awarded the 3-year grant and worked with the Texas Institute for Mental Health in 3 expansion communities, one which was MHMR of Tarrant County. And due to their successes with the Help Me Grow framework, even though Project Launch concluded in 2019, we are looking for ways to continue and expand on their work through our Title V efforts. And as Michelle mentioned, around the same time, Tarrant County's work with Help Me Grow sparked interest in other communities throughout Texas. And the communities were reaching out to MHMR and Help Me Grow National. Due to the increased interest in how other states participating in Help Me Grow are structured, Help Me Grow National identified the need to have an organizing entity within Texas. They were able to convene state partners, including the different state agencies that work on early childhood initiatives, advocacy, and nonprofit organizations, and community partners to talk about the best approach for Texas. Help Me Grow National also approached Texas with an opportunity to support the creation of a state organizing entity and 5 additional community sites. So with talking with our state and local partners and our leadership at the agency, DSHS decided that Help Me Grow aligned with our current work to support family-centered health systems. And so in the role as the hub, with receiving guidance and technical assistance from Help Me Grow National, DSHS will lead implementation strategies, quality improvement, communication, and community engagement. We also decided we needed to look at ways that this could be replicated successfully in Texas, which led to connecting with Tarrant County as a demonstration site. So on this slide, there are the core functions that we have currently identified that DSHS will provide. We're still in the early stages of development and still determining how this work will be impacted by COVID-19, but we are very excited for the potential of this project and to see how Tarrant County continues to implement Help Me Grow and serve as a demonstration site for Texas. We also realize that communities in Texas are in various stages and are aiming to create a structure that can support each stage. So now I'm going to turn it over to Michigan.
Thank you. Thank you to our colleagues from Texas. I am Matt Gillard. I'm the president and CEO of Michigan's Children, and also the co-chair of Michigan's statewide Prenatal-to-Three policy initiative. So I'll start with some facts about Michigan. So in Michigan, we have almost 700,000 children between the ages of 0 to 5. Half of those children roughly are eligible for free or reduced lunch, and 43% of all children in Michigan are eligible for Medicaid. Also, from an organizing structure, our Department of Education houses the Office of Great Start, which coordinates all of our early childhood investments from prenatal to 3rd grade. This office was created under our previous governor, Governor Snyder, and has been in existence for close to 10 years now, probably 9 years. We also have divided government in Michigan. That's not on the slide here, but we have divided government in Michigan. We do have a Democratic governor and a Republican-controlled legislature. So a little bit about Michigan's early childhood advocacy. We have a history of success. We implemented what at the time and may still have been the biggest statewide increase in pre-K funding for early childhood in Michigan back in mid-2010s with a Republican governor and a Republican-controlled legislature. We increased our pre-K funding by about $150 million. And that really, is a history that we can build on as an early childhood advocacy community of having success in challenging political times to create the momentum necessary for investments in early childhood opportunities. We have strong statewide organizations, Michigan's Children being one of them, but several others as well that have committed to early childhood advocacy as being a core part of their work to help lead the efforts at the statewide level. And we also have local partners throughout the state that are engaged and knowledgeable. Our Great Start system in Michigan was started back in the 2000s and consists of local Great Start collaboratives and, even more importantly, local Great Start parent coalitions parent coalitions as well that have been huge advocacy tools in a lot of the efforts that we've done. They're based on our intermediate school district structure or MAP. So we have about 53 of those around the state. And everyone in this, we think is very important in these political times, especially even before the COVID crisis, but is committed to being opportunistic and supportive of what opportunities we either have or have been able to create. So we had allies on the pre-K fight that weren't necessarily pre-K focused, but now as we shift to childcare, we're going to expect those pre-K allies and the folks that are focused on pre-K and other issues to jump on board the childcare train as we move forward as well. And another big thing about our early childhood advocacy efforts is we've been very blessed to have the business community engaged and enlightened on these issues. And they've been a huge factor in getting us to achieve the success that we've had from an advocacy standpoint. And I know Anissa and Alexa especially will touch more on that as we move along.
This is Anissa Eddy, and I'm a Pritzker Fellow in Kent County, Michigan. And I wanted to talk a bit about the local and state partnerships that we have with our local county as well as the state. So for my role as a Pritzker Fellow, I'm one of 14 fellows across the country, and the Pritzker Fellows program was established by the Pritzker Children's Initiative, and it's in collaboration with the National Collaborative for Infants and Toddlers. And really the goal of this program is to build catalytic leadership and capacity in communities to drive an ambitious prenatal-to-three agenda. And a big focus of my role is connecting what's happening in the local community with broader work at the state and national level. In my community in Kent County, we were able to do a needs assessment locally and really look at our early childhood systems and identify not only things that were working well and assets that we had, but also gaps. And then through those gaps, we also were able to create a community vision with a lot of collaboration from family and parent voice and our early childhood organizations and leaders. And I think this is a really great step for folks that are thinking about places to start when you're looking for collaboration, is to get a sense of your landscape and what your local needs are, because then you can really identify those places where there is momentum and opportunity to connect with broader state efforts. Certainly in our local community, we did see childcare as a very significant need area, and that's also something we saw a lot of alignment with when it came to our state and other communities across our state. In Michigan, the unemployment rate has been very low. Obviously, much has changed in recent days with COVID-19, but that is something that often people were not able to connect with increased need for childcare. When you do have a very active workforce and a low unemployment rate, those childcare demands increase. And many Michigan families are having all parents in the workforce, which requires significant need when it comes to our childcare industry. In terms of childcare, we find, along with many other places across the country, it's very expensive for families, and there's just not enough affordable, high-quality slots to meet that need. Childcare is so vital to enabling our workforce, and that's something that our local community really wanted to address. Not only because there's a need for families, but we also want to think about our provider community and how to help those business owners keep their businesses open and also have the sustaining wages that they need and that they deserve for providing this vital service. So work in our state and local collaborations has been so significant in moving this forward. Just put up on the screen a couple of the different groups that I'm connected to, both locally and across the state. So we have a local prenatal to third grade work group that I convene, and of course that includes much of our efforts in the 0 to 3 space. And then I'm also on the advisory for our Great Start to Quality, which is our state's rating system for our child care providers. In addition, we have a Kent County Shared Services Alliance that's recently been established to support our child care providers, and I co-facilitate that. I'm also on an early childhood regional group that is called Talent 2025. This is very much a platform for the business community to have their impact in this space as well. And then on the state level, the Shared Services Alliance, which we have for Michigan, as well as the Prenatal-to-Three coalition that Matt mentioned. And even though it looks like so many different groups that I'm sitting on, part of that really does help to make those connections, because I can hear what's happening on the ground locally and from individual practitioners, providers, and families, and then also connect that to work that's happening at the state level and vice versa. And I think the more you can have that coordination and some of that alignment, we can then be speaking with one voice and moving efforts forward in a collaborative way that can create the action and the momentum that best will serve our families. One of the things that I wanted to just share as an example is our state recently developed an early childhood policy agenda. It's a statewide policy agenda that we developed with planning grant funds from the Pritzker Children's Initiative. And for that agenda, it was vital to have local communities represented in what the state was going to prioritize. And to do that, we had many, many meetings and action team gatherings across the state to get information and feedback. And because I was connected to the state work and the local work, I was able to repurpose a local meeting so that it could be a feedback session for this policy agenda and connect real stories with real families and providers that could then strengthen the priorities that were created with the statewide policy agenda. So these are some examples of how the state and local connection can really be maximized so that we are in alignment and serving our kids and families to the best of our ability. That kind of nimble flexibility is so important to move this work forward. Back to the childcare example, another thing that I've been exposed to is a very innovative model called TriShare. And I think that the connection between state and local collaboration is so prominent in this example. And I'm going to turn it over to Alexa to share more with all of you.
Hi guys, my name is Alexa Kramer. I am the Director of Government Affairs at the Grand Rapids Chamber of Commerce in West Michigan. And so my role at the Chamber, I am one of 3 in our Government Affairs team. I am a registered lobbyist, so I spend a good chunk of my time in Lansing, our capital, and I handle all of our education and workforce development policies, as well as our tax and regulatory affairs policies. Education and workforce development being a little bit more fun than tax policy, as one can imagine, and really where my passion lies. So I'm really grateful to be able to do this work on behalf of the West Michigan business community. So we have a quite extensive legislative priorities process at the Grand Rapids Chamber. And through that process that is member driven, we've recognized childcare for quite some time as both an early education and a workforce development issue. Early education, I don't need to go through because I will be preaching to the choir, of course, but workforce development being that once parents know that they have a safe, reliable, affordable childcare facility for their children, they're able to then enter the workforce, upskill themselves, and better provide for their families. And so the Chamber has been involved in this work for a little bit of time, but since my time at the Chamber, just a little over 2 years now, and diving into childcare, we really wanted to be able to bring up the business voice in childcare. So it's really the Chamber's why getting involved in this, is we really wanted to be a leader statewide to bring forth a coalition that had a bunch of different perspectives at the table to rally around different innovative ways to break down this really complex issue of childcare. And so the purpose of our coalition I really laid out is affordability that leads to quality, workforce development, increasing the labor market, impacting those poverty cycles, and then really rallying the business community support. And so what we did is, as this coalition formed, and we got together back in August of 2019 is when we first convened and have been ongoing since then. And Matt sits on the coalition as well and has been a wonderful coalition partner. We decided to have kind of an internal proposals brought to the larger coalition of what can we really focus on, what can we really drive all our attention towards. And what rose to the top was the idea of this TriShare model, and it really getting to the cost of childcare, which Anissa kind of laid out was just so overbearing for a lot of different families, and splitting that cost between family and government, but also bringing in business. And so really the big portion of this model being those 3, and then also providers, of course, and then something called that we kind of deemed a facilitator hub, for lack of a better term, that I'll get into on the next slide. And so while looking at this model, we decided the best way to go about this model in Michigan is to first start out as a pilot program. And what we really want to do is, because this is such a complex issue and it's something that varies from region to region, we really wanted 3 pilots to be done at the same time, one in an urban, one in a suburban, and one in a rural setting, just because we wanted to have that different perspective of how this could be done in each different setting, knowing that, again, this issue is so complex, it's going to look very different. So we were intentional on that. As we started to develop what we wanted to do and what we wanted to accomplish, we determined that we didn't need necessarily legislative action on this, but we did need to do the boilerplate language route instead. And so putting boilerplate language in our fiscal year 2021 budget that is being developed now for fiscal year 2021 is something that we wanted to do instead. And so we have been working on what this boilerplate language will look like. And so the 30,000-foot view of what this is like I mentioned about this facilitator hub. And so this hub is necessary to apply for the pilot. So there will be an application process into the state to become a pilot, one of the three, and you would need something called a facilitator hub. Again, we were very intentional not to kind of lay out what we wanted that to be. We wanted that to be able to have some flexibility, again, knowing that different regions might need different things. And so that hub could be a nonprofit, for-profit, existing entity, a newly formed entity. We were really intentional to leave that language pretty broad. So we refer to it as a facilitator hub. And so the main role of this hub would be providing administrative and regulatory support, which we think is really important, be a liaison between the businesses and the providers, and then determining supply and demand, supply being the availability of childcare openings that providers have, and the demand being what the businesses are needing, and then the fiduciary of the funds as well. And so businesses would voluntarily elect to be in this hub. And so once they decide to be in a hub in this model, they would have their eligibility expanded for their workforce alone. So we in Michigan have our eligibility is at 130% the federal poverty level. There might be a chance of getting it up to 150% in this next fiscal year. Our pie in the sky as a coalition is 250% federal poverty level, knowing that that is a pretty drastic jump, but really wanting to expand that eligibility for the workforce. So businesses that elect to be in this would have that opportunity, and that could look different for different businesses. And again, we leave that open to that local control. And we think that this is a really great talent attraction retention tool for businesses. We know that talent is really hard to come by in business, and making sure that they have the right skills. And then also knowing that childcare is a major workforce development barrier too. And so we think that businesses having this benefit for their employees is a great attraction and retention tool. For the providers, obviously would work with this facilitator hub to communicate availability, but a big portion of this, and the reason why the providers should want to be in this hub, is that they would have some of that regulatory and administrative burdens lifted, which we know is so critical for providers. And it's a tough business to be in, and so having that burden lifted could be very critical. And then families, of course, having that major barrier that we've been talking about removed, and also having that spot for their child, knowing that their employer is working with this hub and the providers in their area to make sure that their child has an affordable, safe, high quality childcare facility for them. And so the pilot timeline and next steps where we're at now is that we've really been focusing on having conversations with key leaders. So earlier, we started back in early 2020, and it just so happened that the governor also was wanting to put childcare in the spotlight too. So I was brought into her office knowing that she was going to talk about childcare in her state of the state. So that worked out actually very, very nicely. We now have the governor's office staffer on the coalition too, working to help kind of craft what this will look like, and have been really appreciative of those efforts. Had really great conversations with our Senate Majority Leader and Speaker of the House. And so now we are working with the Legislative Service Bureau and the Health, the Health Fiscal Agency. I'm sorry for that typo. Both of which are able to put kind of what the idea of the coalition has been brought about, and then putting it in legalese, really. And so the idea is to have it included in both the Senate and House versions of the budget, and then, of course, signed into law. And so our immediate next step is really continuing outreach meetings, so working through key leaders that need to know about this effort. And then also, so think of, chairs of appropriations committees or chairs of key policy committees. Those are the meetings that we're going through now. And then we're also looking to engage coalition members to really rally support, knowing that if and when this does get signed into law and these pilots are starting the process of getting up and running, we're really going to need all of the folks at the table having their contacts all over the state, the local level, at the state level, really rallying support around this. And so with that, I will turn it back over to Karen. Thank you.
Thank you so much. Thank you to everybody. Such interesting work. I'm very excited about both your the work that you've talked about. I know you're doing way more than this, but these two examples are just terrific at bringing together what we want to happen, especially for babies and toddlers. So I have a few questions for you, and before I ask them, I want to remind our audience to go ahead and put your questions in the chat box. Chloe will be, from the hub, will be pulling those together and offering them up in a few minutes. But I just have a couple of questions I want to ask each group about some of the things you've said. So Andrea in Texas, I want to know, you talked about so many partnerships. That was fantastic. But what steps can the audience take if they're in an area where they don't have many partnerships or not a lot of formal partnerships between the state and the community and within the state and community? And I'm wondering, what is your advice about that? You know, kind of where to start with it, and then how do you expand it in the ways that you all have? And if somebody else is better to answer that, I just thought you talked about it, so I wanted to hear what you thought.
Yeah, thank you, Karen. And definitely, I encourage my the other presenters to chime in on this. But, you know, I think that's something that we're facing right now in Texas. Our communities are all at different levels. And so one of the advantages of having this statewide group is that they can tap into us, and we're constantly doing outreach to communities, and then we can help them to make those connections. And so I think there's some value for example, if someone is in this state lead type of role, to be, one, actively reaching out to communities, and two, finding a partner such as the United Way that has those connections across to different communities, so that we're not putting the burden on communities alone to be doing that kind of outreach. I'd also say, though, that other things that might work really are, if, you know, just asking around, trying to see who else in your community is doing this work. We've seen that these kinds of backbone organizations have been really critical in connecting what's happening at the community level, and then leveraging their work in figuring out who are other contacts that they can reach at the state level. And then, of course, if they're able to reach out to other communities who have these kinds of contacts. I think the other thing might also be just reaching out to your legislators, though, and letting them know that early childhood is something that the community is really interested in and wants to start working on. And I think they can also help with a lot of those connections.
Great. Thank you so much. And another question, I think, Audrey, you talked about this, about your work being a demonstration site for the state. And I'm just curious, does the state fund you to be a demonstration site, or do you have to raise money or find money to help other locales who are interested in this? I'm just always interested in how that works.
So this is Audrey, and I'm actually with the state, and but we did work with Tarrant County to provide some additional funds for them to be a demonstration site, because we really needed to see what works and what doesn't work with this model, and kind of determine the best practices. So then when we're going out into other communities that aren't quite as evolved as what Tarrant County has created, that we can learn from them and take that to other communities.
Excellent. That's very helpful, and that's wise of the state. I will tell you to understand that being a demonstration site is not an easy job, and that it takes funding and staffing and all of that to make it happen. So it's a great investment of money. I'm happy to hear about that. And then my last one for the moment is, and Anissa, I think I would like to know this from your perspective as a community leader. In what ways is your state and local collaboration working to dismantle inequities for vulnerable infants, toddlers, and families? I know you're doing a lot in your state about this, but give us a few examples if you will.
Sure. So I think one of the things that's really important when you're wanting to make sure that equity is at the center of this work is to really have strong data. And I'm talking about both quantitative and qualitative data when I say that. So it's important for us in Kent County to make sure as much as possible to have data be disaggregated, so that when we're looking at things like healthy births and access to childcare, early literacy, and housing security, all those kinds of things, that we're not just looking at the aggregate numbers, but we're breaking it down by race and ethnicity and income level and geography, so that we can see where there may be needs for targeted strategies based on how people are situated. And then I think what's been important in Kent County is that when we're looking at our disaggregated data, we're also then wanting to see what those directly impacted are saying in terms of their stories. So the data can inform some direction, but then you have to have mechanisms for feedback from families to be able to tell you what their experiences are and really determine what it is that they need. And so that's something that we're also really pushing the state on. I know sometimes when you get to these large data sets, it's hard to get those kind of disaggregations, but that really is going to be important when we have a focus on trying to improve equity and really think about communities that are on the margins. For just one brief example that's happening in our community, we look at our birth equity data, and we know this is very similar across the entire country, and we see that Black or African American babies are more than 2 times likely to be born at a low birth weight. Similar stats are true for infant mortality and maternal mortality. So one thing that our community is doing right now is developing a community-based doula program that will really focus on allowing access to training for women of color to become doulas, and then creating more access for women of color to receive those services, knowing that this is a practice that's growing across the state. But that kind of a targeted strategy is something that you can really develop when you see the needs by looking at disaggregated data. And in the summary sheet that will be provided to the audience later, I do have a link to the data dashboard in Kent County that just demonstrates how you can look at some of these county-wide system-level measures in a disaggregated way.
That's very helpful. Thank you for that nice explanation. So Matt, I have a question for you, Matt from Texas. I love how you are so involved in this work, and you bring to the work the business community and others to help with the advocacy efforts. But give us a couple of ideas about how having the business community engaged on child care issues actually helps the advocacy efforts.
Absolutely. Thank you, Karen. And just to clarify, I am from Michigan. Although
I'm sorry.
Some days I wish in the winter. Weather's getting nicer here now, so we're on the verge of spring.
I'm sure they'd be happy to have you in Texas.
Yeah, it's a great collaboration. The reason I focused or mentioned, even though it wasn't on the slide, the fact that we have divided government here in Michigan is because I think that it makes it even more critical and important, the fact that we have this good working relationship between the traditional early childhood advocates and advocacy community and the business community. And we really forged that a long time ago, working on the pre-K issue, where we had some real, I would say, forward-thinking business leaders in the state back at that time that recognized that investing in pre-K was critical to their long-term future and success. And we've been able to maintain that strong relationship with the business community throughout this process. And now we obviously have shared interests in childcare. Alexa noted that it's a big, issue with their members as far as workforce development. And we know that quality childcare is critically important to the health and well-being and nurturing of young children. And so we're able to work continue those relationships and really utilize each other's assets in ways that can be very effective in this divided political times. The fact of the matter is that, Republican lawmakers have oftentimes different priority areas and issue areas, and the business community can speak to them much more effectively, frankly, than I can at times, and vice versa. You know, the early childhood advocates, traditional advocate community, oftentimes has a lot easier time speaking to Democratic lawmakers, and in this case, the Democratic administration. And so having really both sides of the political spectrum in many ways represented at the advocacy table is hugely important in these challenging political times when everything's divided. And I think the real success is that we've been able to create and really define early childhood in general as a nonpartisan issue, as a bipartisan issue, with recognition from the business community that this is a priority for them, as well as it is from the advocates, the traditional advocates as well. And so it's been hugely, I mean, we would not have gotten to where we got at the end with the pre-K, you know, without the business community support. We're going to get farther than we would ever get on our own on childcare with the business community's engagement. And so we recognize that we both need each other and have been able to foster and really continue that relationship to the benefit of Michigan kids and families.
Thank you, Matt. Alexa, I have a question for you that's related to the chamber that you're involved with. How can early childhood advocates across the country develop stronger relationships with their local and state chambers? I know it varies across states, both at the state level and at the community level, but do you have any advice for us about that?
Yeah, so there's a saying in the chamber world that if you know one chamber, then you know one chamber. Because yes, indeed, every chamber, no matter the size, all over this country is completely different. But again, like Matt said, this is an issue that really ties everything together and is a really good rallying point for a lot of folks, quite frankly. And if you care, and the way that I frame it for my members is, if you care about any issue in front of the business community today, it directly ties back to ensuring that we have a strong early childhood education system in our state, right? And so this is a really good rallying point. And so I would just encourage all of the early childhood advocates all over the country to really try to develop that relationship with their local and state chambers. Some of them are going to be more responsive to it than others, of course, but again, making sure that you're tying it all together, because if you care about workforce development, then you should care about the barriers to that. And if you care about education in any broad sense, you have to care about the most critical years of a child's life that build that foundation, right? And so if you care about this education in the broad sense, workforce development, then you have to care about early childhood education as well. And so just making that case and really building those bridges is really helpful down the road.
Great, thank you so much. So Chloe, we're ready to turn to our audience and see what questions we have for our panelists.
Wonderful. Thanks, Karen and team. So the first question we're going to recall, Andrea from Texas did respond to this earlier, but we did have a few people join thereafter. So we're just going to repeat this question. Can you explain home rule?
Hi, Chloe. I'll do my best. Home rule is essentially when, as a city, you can create your additional regulations and laws within your city. It's usually for cities that are a little bit bigger. I think in Texas, it's if you have over 5,000 inhabitants, then you are eligible to become home rule. And if you're past a size that's even larger than that, then you have a few more tools at your disposal. But really, if you're a small municipality, it's that the laws that you follow are the ones from the state. Home rule communities follow those state laws, but they also have ability to do a few more laws. And that was just coming out of as cities and counties are kind of figuring out what levers they can use in terms of what they're able to do with early childhood, it's just really important to kind of figure out what you're able to do, kind of what your administrative unit is, what are the kinds of tools that you have at your disposal in terms of making rules and regulations and in terms of collecting revenue.
Awesome, thank you. Next question, please explain more about Help Me Grow framework for Audrey.
Yes, so really the Help Me Grow framework has 4 different components. One of the components is a centralized access point. It also has a component that's family and community outreach, and then child health provider outreach. And the last component is data collection and analysis. And it's really, think about it, I think it was on Michelle's slide, 4 different gears that work together and move. They can move at different points, but they are working together to power the machine. And it really, the goal is to improve children's access to developmental screening. And so by those gears moving, you work within the community to improve access.
Awesome. This leads into another audience member. I would love to hear about how data collection in local communities and counties would look like, what that process looks like.
So we are still developing that out. We currently only have the one community, which is Tarrant County, and so they're working on how they're going to collect their data. But then once we get more into this project, we will determine what the data collection will look like in the individual communities.
Hi, and this is Michelle. I can also respond to that. So at the local level with Help Me Grow, we do have one of the core components being built out currently, the centralized access point, and this is really heavily tied to our data collection and analysis. So the centralized access point acts as essentially a no wrong door approach. So wherever families are accessing services or resources, the idea is that they can then connect to developmental screenings, to any resources in their community to support the child's development. And so that intake happens at each of those access points, so to say. And so this happens in health providers' offices, it'll happen in childcare, as well as the call center and online, which is really what kind of the Help Me Grow centralized access point is known for, is having that as an access point. And so all of those are connected by one data system, which is collecting data on intake, on the screenings, on the family's needs. And actually this particular system we are using is one that is fairly new. It's really just been used in California in one hospital system. And it's and I think it's being explored as well in New York with Help Me Grow. And so it's called Find Connect. And I can't quite remember who the developer is, but you can find it online. I'm sure we can send out some information about that after the webinar.
This is Anissa, and I just wanted to add to the data question as well. Obviously, there's many things that we can get at a state level, especially when you get up into K-12 system data or basic needs data. But I do think that there are often challenges when it comes to local community data in terms of early childhood systems, because much of that isn't necessarily collected in the same way or aggregated up to the state. But I would just encourage communities to also reach out to your local universities, because often they can be great partners in just imagining what data collection might look like and trying to utilize some of their resources and tools and even the expertise within their departments. Your local universities and colleges, as well as your local ISD, can sometimes help you to create mechanisms to gather, collect, and analyze local data that can inform your early childhood work.
Awesome. Next question is there Head Start and Early Head Start as a form of childcare offered in either state when it comes to working with those particular childcare centers?
From Texas, yes, at the local and the state level.
That's the same for Michigan, but I will say that in terms of early Head Start, it's much more limited. So when we think about our options for 4-year-olds to have preschool programming through Head Start, or locally in Michigan, we also have the Great Start Readiness Program. There's quite a bit of availability, but when you're looking at 3-year-olds and younger, we have much more need and many less children served. So that is an area where we're really wanting to see state and local expansion for access.
And this is Andrea, just to kind of answer that question too for Texas. Our statewide plan does have a component around childcare, and we are working with Head Start and Early Head Start to think about how we can support their work. And in terms of what Audrey and Michelle were talking about with the Help Me Grow model, how there is that sort of community component. Michelle kind of talked about this a little bit, but there is that outreach to childcare centers, because we know that they are often on the front lines of screening, and they're able to kind of assess what's going on with kiddos. And so I know that there's some outreach to childcare providers and Head Start and Early Head Start for some of that work as well.
Awesome. What kinds of regulatory and administrative burdens were lifted in the TriShare Hub for childcare providers?
Yes, so that is one part of the pilot program that we want to give flexibility to that facilitator hub and providers to work out. So we're not going to call on the facilitator hub to do any specific administrative or regulatory asks from the provider, but knowing that they can work with the provider to lift some of that burden off. That's one thing that they must be able to do as a facilitator hub, and be able to demonstrate that they have the capability to do that. So that can look very different. For example, we had a change in our technical assistance manual within the Department of Licensing and Regulatory Affairs on nap time ratios not too long ago, which caused a stir within the provider community. I know that at the Grand Rapids Chamber we have a few childcare providers who are members, and so they reached out to me saying that this was bad, and this might mean X, Y, and Z for them. And I was able to connect to the state to figure out what exactly was needed of the providers with that change. And the whole time thinking, wow, this would be something really great for a facilitator hub to take care of, having access to not only the state, but all of the providers in their region too. So it can look very different, and we expect it to look very different from region to region, but that is intentional.
Great. How are you involving home visiting and other family support programs into your work?
So this is Matt from Michigan, and so I was referenced in my intro slide. I co-chair the statewide pre-K or the Pritzker initiative in Michigan, and it's really focused on two areas. It's focused on childcare, which is what we taught, and part of what we talked about today. But then the other focus is on home visiting. It was really the big push for that. And so we're certainly, this is just one area of work that we're looking at within even a broader childcare agenda. That's a piece of this initiative. But home visiting is a big part of our initiative and our work as well going on.
And in Kent County, from a local example in Michigan, we have a home visitor provider network. So we have a few different home visiting programs, but we have this network that meets monthly so that all of the providers can get together to collaborate and work on moving this forward, and also recognizing how some of their programs can work in harmony depending on family eligibility and what's the best fit. But then the local network really relies on the state in terms of advocacy and really wanting to see increased investment in home visiting and increased funding. So I think being able, again, to connect what we're seeing locally and the needs that these programs and providers are experiencing, get those stories to our advocates at the state level and join in collaboration and coalition building, that really does help. And we did see home visiting increase investment in the governor's proposed budget. Of course, there will be many shifts and things that will happen now as we're all looking at the responses with COVID-19, but we were really excited to see that make it into the proposed budget. And I think that's an example of this movement that can happen when states and the local communities collaborate on similar issues with these common goals.
To that question, someone did ask, how are you all utilizing your collaboratives to support a response to the current COVID-19 crisis?
So at Michigan's Children, what we've been focused on is really gathering data and feedback from communities and from people, both providers and families, on what the specific impacts that this crisis is presenting to them and their families and their children, and then consolidating that data or putting that data together in a meaningful, effective way to share with policy. So up until yesterday, when the Senate finally passed the stimulus bill, we had been providing daily reports to our congressional members where we were consolidating data that we had, feedback we had been receiving from our collaborative members and folks around the state on issues that they're facing. And we're going to continue that effort, as we know that, you know, the crafting of solutions is not done both in DC and will be happening at state capitals around the country here too, as this crisis develops and as we further understand what issues families and kids are having. We think it's critically important that those messages and their voices are heard in these discussions. And so that's what we're doing from a statewide advocacy standpoint, is we're absolutely committed to getting that information into the policymakers' hands in a timely and effective way, so that as they are crafting solutions legislatively, they know what's impacting the folks in their communities.
Yeah, I think this has been a really great example of how important these state and local coalitions and collaborations are, because it really is for times like these when they can be activated and you see the benefit of relationship building and systems building that's happened over time. It's been great to rely on organizations like Michigan's Children and the collaborations that happen at the state to be able to understand and have some of the legislation broken down, and then get it into our local collaboratives so that this information can reach parents and families. We know that parents and families have particular places where they rely on getting information, where they have relationships and where they have trust. But what we've been able to do as collaboratives is make sure that we're sharing resources and having centralized links and pulling in all these different things so that the organizations that have relationships with particular families can get it to them. And then an example specific to childcare, our state did require our local ISDs to coordinate the emergency childcare response to serve the essential workforce during this crisis. And with the collaborations that were already in place here in Kent County, I was able to create a group quite quickly, and we are having regular Zoom check-ins to coordinate our efforts, not only on the ISD in terms of placing families that have this essential workforce childcare needs, but also in coordinating getting resources to families that typically would have things through their childcare provider, such as such as formula, diapers, things like that. And then also for the childcare providers, making sure that they have access to supplies. We were hearing that by the time they were able to get to the stores, usually in the evening or on the weekends, so many things were gone that they require on a daily basis to care for children, and then to elevate that to the broader system to meet those needs. It's been really amazing to see these collaborations just spark into action so that we can be responsive. And I think you just see those benefits come through in emergencies like this.
If I could speak from the Tarrant County perspective. So I love that this question was asked. We are using the Help Me Grow collaborative as a resource for families at this time. We actually did not plan to roll out the Help Me Grow phone line or website really in full scale until we had given it a few more kind of technical tests and really sort of a beta testing phase. But given the current circumstances, we said, you know, families can't wait. We need this out there now. And so we need to figure out all the kinks and work those out as well as we can, and then get this out. And so that's something that we're working on currently is having that hopefully at the end of this week really full scale communicated across the North Texas area that, families that are affected by COVID-19 can now access this as a resource. They can call in, ask questions, and get referred to community resources that are currently available, even given the current circumstances. And so I would also add that we have locally, as well as a few, across the state, a few different response networks. We have a Tarrant County task force who's working every single day to make sure that we coordinate childcare for the essential workforce. The folks that are a part of that task force and that response network are folks that are part of this collaborative. And so it has been really helpful to utilize these connections and trust and relationships during this time of crisis.
Similar to the call center that you mentioned, another audience member had asked, how are you thinking in your states about moving from demonstration or pilot, such as this one, to statewide spread for initiatives that prove effective in one or two local sites? Perhaps in this case, because we are in a state of emergency, and national one at that, are there other demonstration or pilot programs that you're considering to go live statewide very quickly that you think would be effective in one or two local sites?
So I'll talk a little bit about the tri-share and what that model here for Michigan, to the first part of the question, I guess, Chloe. So I'll be honest. I mean, one of the things we as the advocates had concerns with about this as we first started to develop this model was the fact that this is, at this point, obviously going to be a pilot, and it's dependent upon the way it's designed. It's dependent upon voluntary participation by employers. And so what that means for families is, you're lucky if your employer decides to participate in this, you have access to these better, childcare opportunities and reduce childcare burden, cost-sharing burden from your end. Well, when we think about then transitioning this, if this is successful, and we think it will be successful, then what does that mean going to a statewide effort? And so we're very cognizant of the fact that we'll have to figure out some way to maybe institutionalize or to really codify the business engagement or the business involvement or employer involvement in this, moving it forward. But that said, those reservations were overcome and greatly outweighed by the interest and excitement and energy that we saw from the business community in this, and us knowing that we need the business community engaged from an advocacy standpoint to move this forward. And so we certainly recognize and understand that, like any pilot, there'll be challenges to implementing or expanding it statewide. But that said, we think the solution, the ultimate solution for our child care issues in Michigan and frankly across the country, are going to take the coordination and commitment from both the business community as well as the advocates and the government side and the public sector. And so having everybody at the table designing this has been great, and we're committed to seeing this through and figuring out how to bring this to scale if and when it is successful.
And Matt, I'll chime in there too. This is Alexa. And I think that the intentionality behind having 3 different pilots within this first go at it, knowing that this is out of the box and innovative and really exciting, but recognizing that if we do it in 3 different areas, again, being an urban, rural, and suburban area, that we would be able to collect some data going forward and using that data to figure out, again, very complex issue, how this varies between regions and different parts of our state is going to be quite vast. And so we really are going to rely on the data that we're able to use and collect from these pilot programs to inform our efforts going forward. And so we are really excited about the business community's support for this. And we think that, again, having this being a true talent attraction and retention tool is going to be very big for businesses. Again, talent being their number one issue, and you hear that all the time. This is a solution. This is something that they're able to do and show their employees that they're able to do it. So we think that it will be a great pilot starting out, but we're really, really looking forward. What I most look forward about this initial pilot program is what data are we able to collect from it? How can this inform our efforts going forward?
What are the opportunities for county agencies to make services more available to families during this time? I'm curious about how local children's services, tax levy, and other financing strategies can play a significant role in this.
I think that this is Anissa in Kent County, Michigan again. When you think about services being more available to families, one of the first things that's really important is to understand your current state. And I think that we're definitely seeing that push to the limits right now as we're all trying to figure out exactly where we are and what we need. But in general, when you can get a sense of what your community already has and then what the gaps are, you have a lot more information to build on getting more services available. So I did mention the gap analysis that Kent County did, and there's a link to that will be shared in the summary document. But something like that can be a really helpful tool when you're then seeking funding or seeking additional collaborations to move forward additional services and things of that nature. And I wanted to just go back to the pilot question as well, because as communities are thinking about potential pilot programs, I think to have strong evaluation built in right at the top so that you can document and track is so important. And this sometimes is an opportunity to seek local philanthropic support when you're thinking about pilots, because then you can use the information that you get and the success documentation that the pilot gleans to seek more funding and even thinking about policy and state level support to show something that's successful. So that's just another idea for communities to think about how you might approach it. If you can go to local funders to get a pilot project started with strong evaluation, and then think about the scalability and using that as a proof point to bring things further.
And this is Andrea from Texas. I just wanted to say, in terms of what counties can do, I think it's also just really critical within your own state for county leaders to be able to assess what their capacity is, what is legally available to them to do, because that will look really different from state to state. So we've heard, for example, from one of our county leaders who's really interested in early childhood, that in addition to kind of doing this needs analysis and kind of seeing a landscape analysis of what's in their community, they're assessing what levers they have, what powers they have, and what kind of tools are at their disposal for raising money or providing services. I did also just want to go back a step and address what Texas is doing with home visiting. That was an earlier question. And home visiting is part of the plan for our statewide initiative. And so we're also getting Pritzker funding, which we're really grateful for. And as I mentioned, we have these Pritzker communities. And so in one of the ways that Help Me Grow, I think is going to be a really fantastic way is it will help us kind of figure out what is that capacity in our communities, what programs need more support, and particularly with that focus on developmental screening, we know that not all children may be eligible for the IDEA Part C services, but that home visiting, for example, could be a really powerful tool to support those families. And so having this kind of centralized access and referral network will really help us pinpoint who are these families where they're not eligible for this more intensive service, but they could really benefit from home visiting, and kind of how can we connect them to that right program at the right time.
Thank you, guys. And have any of the presenters formed partnerships with tribal programs? If so, how does that look? What was the process? What roles do tribal partners play in your work groups, if so?
So this is Matt. In Michigan, we have some very strong and active tribal communities, and they have been very engaged in our early childhood efforts for many years now. In fact, the Pritzker initiative, the statewide policy initiative on infants and toddlers, is led by an executive committee of 6 of us, and 2 of those 6 are parent representatives who were chosen by part of our parent coalition that through our group of parent groups around the state. And one of them is Meredith. She's great. She's a tribal member from Northern Michigan, has been a very active voice throughout this process in developing our infant and toddler plan, statewide plan, and gives us a great connector really at the highest level of this initiative with the tribal communities. But we have very active tribal communities, have been very engaged. It does, from an advocacy standpoint, it is, there are some differences clearly in the opportunities as well as the challenges that tribal communities are facing are not always the same as what we're seeing in other areas of the state. And the solutions are not always the same either because of their governance structure and other things. But they have been great voices. I would encourage everybody that has tribal communities in their state to engage them. They're very eager, at least in Michigan, eager to be involved, eager to get engaged, and great opportunities to bring a diversity of voices to the table for sure.
This is Andrea. Just on the side of Texas, I think that that's something that we're really working on. We're really trying to identify who are those tribal leaders that are doing this important work and how we can bring them on better. But I do know, and Audrey can probably speak a little bit more to this, that there was a tribal entity who was a part of Project Launch, and they are still a part of that developmental screenings work group.
Yes, we were able to get Lesta del Sur Pueblo. They were one of the 3 expansion communities. That Tarrant County was an expansion community, and then Bexar County, which is San Antonio. So having that tribal community as the 3rd community really gave us the opportunity to learn more about their culture and develop those relationships that we previously hadn't had. And so we're still working with them, and they're on our developmental screening work group, but we're also looking at ways to engage some of the other tribal communities within our state.
Awesome. This speaks to a question that a attendee had regarding how are we engaging parents and other caregivers as part of the planning and giving voice in the local and state level parts of the PN-3 efforts. So thank you for that. For Kent County, is there a website which describes the Kent County shared services?
Not yet. There is a website that is describing the state level shared services alliance. That's been up and running a bit longer. The Kent County Shared Service Alliance is just starting and getting organized, and we didn't do a lot of prescriptive planning because we really want this to be a provider-led coalition where they're describing their needs and then creating what it looks like. So there will be more coming soon, but similar to Tarrant County, even though we were in a bit more of a developmental stage, we have definitely activated it right away to meet the needs of providers as we're responding to COVID-19.
Awesome. And we're looking at 3 more minutes.
Can I add, Chloe, just back to the parent voice and connection? I know that there's lots of different collaboratives, and I think it's so important to make sure that you are including parents and family members as much as possible to serve on those and to even be in leadership roles. But I also just wanted to direct the audience to an amazing resource from the Center for the Study of Social Policy called the Manifesto for Race Equity and Parent Leadership in Early Childhood Systems. This was developed by parents from across the country, and it really provides some tangible framework and steps to operationalize what it looks like to engage parent and community voice in the early childhood systems work, and not just as informing it, but really in that position of leadership. So I think that's a great resource for communities who are looking to incorporate that more.
If I could also echo Anissa's point, that yes, that manifesto is awesome. I would also point to the National Center for Families Learning, or Council for Families Learning, one of those. They have been phenomenal in working with us to support kind of both sides of what it really takes to authentically engage parents and families in any early childhood effort, which is from the organizational side. How are we changing our processes? How are we communicating? Even like, how do we set up our meetings and our meeting times so that it is absolutely friendly and accessible to families? And then as well as the other side of that, which is then for the parents and the families themselves, equipping them with the skills and the knowledge to really be able to feel like they can be confident in being engaged in working together with these organizations and truly informing and leading the work that we do. And so we have had one cohort with that National Center for Families Learning that's been trained. Those parents have been trained to be parent advocates, and so those parents have been informing some of our work thus far, and we're working on restructuring, again, that side of the organizational side, really truly restructuring how we work as a collaborative so that it is authentically able to include parents and families, not just, during the regular business hours when we're all working, but in a way that families are actually able to join and inform and be truly engaged in leading the work. And so while that's happening, we've been engaging them in the building of Help Me Grow, and having them help us with any types of things that we put out, asking for their perspective, things like that. So that has been a really useful resource.
This is wonderful. We have a question from an educator. As a former teacher in early childhood education, there can be so many issues with quality of childcare due to pay and lack of on-the-job training. Are there any advocates for teachers in early childhood education, and what does that look like in your state?
So this is Andrea from Texas. Our Texas Association for the Education of Young Children, TACY, is a phenomenal advocate for our early childhood educators and childcare providers. And they have just significant reach across the state, and really a lot of respect with our state agencies. And so they are a really critical partner in our PN3 collaborative.
This is Matt in Michigan, and I would agree. Our statewide Michigan Association for the Education of Young Children is a similarly very strong advocate, and the national group, NAEYC, is at the federal level as well. And what I would say is our Prenatal-to-Three statewide plan is predominantly focused on workforce support for the early childhood industry. Because we recognized early on, and I think we continue to recognize, and you're absolutely right, the questioner, that unless we address the workforce challenges of this sector of our society, or this sector, this group, we are not going to make the types of changes or create the type of system that we all want to see. And so workforce supports for those in the early childhood field are critically important as we talk about creating the type of system that we want to see for young children and their families.
Thank you so much, everybody. These presenters were so terrific. I know our participants join me in saying thank you, because you were so good at giving us the overview, but then getting into the very depths of the details, and your honesty and your knowledge about your work and your passion for your work is so obvious. So we say thanks, and you'll probably hear from us all again in various ways. So we'll try not to overwhelm you. We're grateful for your time, and we really applaud this important work and timely work for sure. Just to remind you that you'll get an email from the Hub in the next couple of days or so that will give you the presentation and the links. It'll give you some of the information that has been discussed today. Don't forget to respond to the link to let us know how the webinar worked for you. That will be coming up. Well, the survey link is right there on the screen. So let's all continue our critically important work with and on behalf of young children and their families. And thank you all for participating.